Hello friends, today we are going to discuss about an important novel antipsychotic, Pimavanserin. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing a novel antipsychotic, Pimavanserin. This is a 5-hydroxytryptamine receptor antagonist and an inverse agonist. What does these two words mean? Antagonist and inverse agonist. Antagonist means blocking the receptor. For example, antipsychotic risperidone, that is antagonistic for D2 receptor. That means it blocks the D2 receptor. That's it. It blocks. It doesn't do anything much. Whereas inverse agonist means it not only blocks the receptor but also have a negative effect similar to agonist. So here Pimavanserin is an inverse agonist. That means it has an opposite effect of the agonist. That means it not only blocks 5-HT2A receptor but also has a intrinsic activity of its own, that is reverse activity of agonist. And it blocks 5-HT2A receptor with high affinity. It also has a less potent effect on 5-HT2C receptor, my dear friends. So, Pimavanserin blocks and also has an intrinsic negative effect or intrinsic activity of its own. That you need to understand. Further, Pimavanserin does not have any effect on dopamine receptor. That means it does not blocks. It does not block adrenergic receptors, does not block histaminergic receptors and muscarinic receptors, my dear friends. That means it has lesser side effect. It is a non-dopaminergic blocker antipsychotic. That is how it has been introduced into the market. Let's understand about the history of Pimavanserin. In 1990s, the people were looking into why clozapine is so effective. Apart from D2 blockade, does it have anything else? And they found it blocks 5-HT2A receptor. So they started to look for a novel molecule which affects 5-HT2A receptors. The simple reason is the blocking D2 receptor not only improves psychotic symptoms, but it causes severe motor symptoms, especially in Parkinsonism disorder. Hence, the scientists started looking into the receptor selection and amplification technology based on 5-HT2A agonist and antagonist. And they developed Pimavanserin, my dear friends. Once the Pimavanserin, which was introduced, it was introduced as a liquid formulation. But because of the unpleasant taste, and senior citizens, especially the patients with Parkinsonism, found it very, very difficult to swallow it. And because of aesthetics, they started looking for a capsule. Then gelatin capsule was developed. Hence, Pimavanserin is considered to be a non-dopamine blocker antipsychotic. Now let's understand the mechanism of action of Pimavanserin. This is the molecule of Pimavanserin, and when it was introduced, it was considered as ACP-103 as a molecule. Hence, if you look at the PubMed search, invariably the earlier articles are published in the molecule name as ACP-103, my dear friends. So let's look into the effect. You can see here, it blocks 5-HT2A receptor, my dear friends. And the effect is very strong, and it also has an intrinsic effect on the receptor. Whereas on 5-HT2C receptor, the effect is very minimal. And it does not have any effect on dopamine receptors, adrenergic receptors, histaminergic receptor, and muscarinic receptors. Hence, the side effects are very minimal. So, please remember, pimavanserin is a 5-HT2A receptor antagonism and inverse agonism, whereas 40-fold receptor activity is less on 5-HT2C receptor when compared to 5-HT2A receptor. Now you can see this beautiful diagram, which clearly talks about pimavanserin, that is antagonizing 5-HT2A receptor and 5-HT2C receptor. Here, if you look at that, 5-HT2A and 5-HT2C receptor. With regard to 5-HT2C receptor, it has a low affinity, lesser than 40% of the 5-HT2A receptor. Whereas 5-HT2A receptor, the binding is high affinity, my dear friends. Whereas with regard to D2 receptor, it doesn't have any effect. So how does it works? Through 5-HT2A receptor and 5-HT2C receptor, it modulates dopamine. It reduces dopaminergic activity through mesolimbic system. That is how it has been formulated, my dear friends. So, the low affinity for 5-HT2C receptors and high affinity for 2A receptors causes excessive stimulation of 5-HT2A and 5-HT2C receptor, which in turn reduces the hyperactivity of dopaminergic pathway, that is mesolimbic. By this, it reduces delusions and hallucination, my dear friends. Now we need to understand where it has been approved. Pimavanserin has been approved for Parkinsonism disorder-induced psychosis or PD psychosis. It can be because of medication of Parkinsonism or because of Parkinsonism illness itself. Then it has been approved there. Then how we diagnose PD psychosis? Parkinsonism disorder psychosis, at least one symptom should be there. Either illusions, false sense of presence, hallucinations, and delusions. This is the criteria given by NINDS and NIMHA. NINDS means National Institute of Neurological Disorder and Stroke and National Institute of Mental Health. Either of the four, one symptom should be there, my dear friend. Illusions, hallucination, delusions, and false sense of presence. False sense of presence means somebody is behind me, somebody is there in the room. Further, to consider as PD psychosis, a primary diagnosis of Parkinsonism disorder has to be diagnosed first. That means the patient should be first diagnosed to have Parkinsonism. Later, the psychosis has developed. The duration of symptom of psychosis should be at least 1 month, or it is recurrent. And other diagnosis of psychosis causes like alcohol-induced, drug-induced should be ruled out, my dear friends. If you look at the PDP psychosis, that is Parkinsonism disorder psychosis, the prevalence varies between 50 to 50%. That means based upon the duration of psychosis, duration of Parkinsonism disorder, duration of medications given, what type of Parkinsonism, anti-Parkinsonism disorder medications are given, based upon that, the prevalence varies between 15 to 55%. Invariably, if the patient is suffering from Parkinsonism disorder for more than 10 to 15 years, invariably 50% of them will develop psychosis. Either it can be because of medication, anti-Parkinsonism medication, or else Parkinsonism itself can cause psychosis, my dear friends. That means the prevalence increases as the duration of Parkinsonism disorder increases. So if you look at the American Academy of Neurology classification, the recommendation for PD psychosis, either the first level is pimavanserin, that is level B, clozapine is level B, quetiapine is given as level C. So the evidence available for pimavanserin is level B, my dear friends. So in Parkinsonism disease psychosis, pimavanserin or clozapine can be considered. Hence, the approval for pimavanserin occurred because of a pivotal trial, one of the important trial. And this trial used modified scale for psychosis assessment. And invariably, because of this modified scale of assessment, many experts raised doubt about the effectiveness of pimavanserin. Although there was a doubt raised, on 2nd September 2014, FDA of US considered as a breakthrough therapy designating pimavanserin for PD psychosis. In 2014 only it is considered as a pimavanserin as a breakthrough drug. The pivotal study which was considered as, this is the study. The study was published in Lancet in 2014. The study was titled was Pimavanserin for patient with Parkinson's disease psychosis, a randomized placebo-controlled phase 3 trial. Cummings and his colleagues between August 11, 2010 and August 29, 2012, approximately 1 year, they randomly allocated 199 patients, my dear friends. This was a 6 weeks randomized, double-blind, placebo-controlled trial. Authors enrolled the patients who are more than 40 years, primarily diagnosed as Parkinson's disease, not on any antipsychotics, who had developed psychosis now, were allowed into this study. In that, 90 patients received a placebo, 95 patients received pimavanserin. Here, they consider two outcomes. One is primary outcome measure, another one is a secondary outcome measure. The primary outcome measure, as I mentioned earlier, it was measured by a Parkinson's disease adapted scale for assessment of positive symptoms. The improvement seen on this was considered as a primary measure. The secondary measure was used as a clinical global impression scale, that is either improvement scale or a severity rating scale. And here the independent raters rated the patient. One is at the baseline and every interval, or at the outcome, my dear friends. If you look at the study results, at the baseline, the randomization was so good, they were equally distributed. Once the study completed, you can see on the primary outcome measure, the drop after the medications with pimavanserin was significant, minus 5.79, my dear friends. Whereas one placebo was 2.73. That means there was a significant improvement. Further, if you look at on CGI score, my dear friends, clinical global impression scale, in the severity rating scale, the baseline both were same. That is placebo arm and also pimavanserin arm. But at the end of 6 weeks, my dear friends, if you look at the score, it was 1 for CGI severity rating scale. If you look at for the improvement scale also, my dear friends, again, the improvement was significant. So on both primary outcome measure and secondary outcome measure, pimavanserin showed a significant improvement when compared to placebo. However, 10 patients on pimavanserin dropped out because of the adverse effect of the medication. Similarly, 2 patients on placebo group dropped out of the medicine. Overall, pimavanserin was well tolerated with no significant safety concern for worsening of motor functions. Why the specific word motor function? Imagine a patient with Parkinsonism disease having psychosis, and if you give haloperidol or risperidone, it will cause severe Parkinsonism, my dear friend. Hence, we are giving a novel antipsychotics, and this did not cause any worsening in motor functioning. Hence, on 29th April 2016, pimavanserin was approved by FDA for treating hallucination and delusion associated with PD psychosis. It can be drug-induced, it can be independent. In drug-induced, invariably you need to titrate the dosage of the Parkinsonism drugs. If anti-Parkinsonism drugs cannot be decreased, then pimavanserin should be used. Invariably, the offending drugs has to be decreased. That is the first line. But if it cannot, pimavanserin has to be added. Hence, pimavanserin was approved for PD, P, my dear friends, that is Parkinsonian disease-induced psychosis. However, currently the preliminary studies, open label studies, few case reports are reporting it reduces hallucination in mixed dementia, but currently it is not been approved for dementia related psychosis, my dear friends. Now let's understand the dosing of pimavanserin. It is available as 34 milligram capsule, that is gelatin capsule, or else 10 milligram tablet. It is administered orally. Earlier it was started as a liquid, but it has a very bad taste and many of the senior citizens refuse to take it. Hence, it is now a gelatin capsule. Either it is available as 34 milligram or 10 milligram. A single dosage. It can be given with food or without food. That means it does not have effect if you take before the food or after the food. 95% of the pimavanserin is protein bound. If you look at the half-life, it is 57 hours. And steady state is achieved after 12 days. It undergoes hepatic metabolism through the enzyme CYP450, 3A4, and 3A5. The major active metabolite of pimavanserin is N-dismethylpimavanserin, which has a similar receptor activity to pimavanserin with a half-life of 65 hours, my dear friend. Hence, considering the half-life, it is given single dosage as 34 milligram per day, my dear friends. After oral dosage, 0.5% is excreted unchanged in the urine, while as 1.53% is eliminated in feces, my dear friends. If you look at the pimavanserin pharmacokinetics are not significantly affected by the patient weight, age, sex, or ethnicity. Further, pimavanserin exposure in a patient with mild to moderate renal impairment or a hepatic impairment, there is no need of changing the dosage. That means it is safer in a patient who are mild to moderate renal and hepatic impairment patients. That means if a patient has milder renal impairment or moderate renal impairment or hepatic impairment, there is no need to change the dosage. That means you can go ahead with the 32 milligram of pimavanserin. And recent open label trials have clearly showed that pimavanserin does not have any change in its bioavailability when it is taken with the food. It can also be given by emptying the capsule into the food or liquid. For example, many patients find it very difficult to swallow the gelatin capsule, or else they do not want to take the medication. Simple reason is they are suffering from psychosis. They have paranoid ideas. The patient may have persecutory delusions and they refuse to take medication. In such a scenario, the gelatin capsule content can be put into food. It can be put on sprinkled on various food, applesauce, orange juice, water. In that time, bioavailability does not change, my dear friends. That means it can be given easily in a covert medication also. That is how pimavanserin is very safe. What are the side effect profile? Various studies have said 5% of them develop peripheral edema, 6% confusion, nausea, vomiting is there, but it is tolerable. QT prolongation is known to some extent. But however, with regard to pimavanserin, there is no information is available with regard to pregnancy or congenital malformation. That means currently there are no studies about this. So it is very difficult to comment on pregnancy and congenital malformation. Most of the clinical trials programs, pimavanserin is appeared to be safe, well tolerated, particularly with respect to the lack of deleterious effect on motor symptom of Parkinsonism disorder. And you can see here, the studies have clearly showed the side effect. Peripheral edema, it is double, 3% with placebo, 7% with 40 mg of pimavanserin. Confusional state, 3%, 6% with pimavanserin. Here, the dosage was given in the trial was 40 mg, but the available dosage is different. That is 32 mg, my dear friends. When you compare with other antipsychotics, like there are no studies available, head-to-head comparison with pimavanserin with either risperidone, clozapine, or quetiapine, we do not have. Hence, a network meta-analysis between clozapine and pimavanserin was performed to assess the efficacy and safety of pimavanserin compared to atypical antipsychotics for psychosis in PD. 17 clinical trials were found. On head-to-head comparison, clozapine was found to be more robust compared to pimavanserin, whereas pimavanserin was equally effective as quetiapine. That means even today, after the pimavanserin has been approved by FDA, clozapine continues to be very effective in Parkinson's disease psychosis. However, the side effect profile of pimavanserin scores over clozapine, since clozapine has severe side effects such as sedation, difficulty in swallowing, hypersaliuria. Hence, pimavanserin is considered over clozapine. So, for this reason, pimavanserin, because of the very good side effect profile, it scores over clozapine. But effect-wise, clozapine. Pimavanserin theoretically can increase the QT prolongation. However, there are studies when it was combined with other antipsychotics, they did not find any clinically significant causing heart blocks. That means QT prolongation did not cause severely requiring cardiac intervention. That means, however, you need to be very careful when you are combining pimavanserin with another antipsychotic which increases the QT prolongation, but it is not contraindicated. The relationship between serotonin receptor and dopamine receptor modulation leading to control of hallucination, delusion, and psychosis is very welcoming, but still we do not know the exact mechanism how 5-HT2A receptor blockade and inverse agonist, how does it have an effect on dopamine? What about the post-marketing surveillance? It was released in 2016. A study assessing the Medicare database showed that the patient taking pimavanserin for Parkinson's disease psychosis compared to those with no treatment over 1 year had an increased risk of death. That means if a patient who has psychosis and Parkinsonism, if you don't give any antipsychotic or including pimavanserin, the mortality rate increases. Nevertheless, another study of Medicare database revealed that mortality was about 35% lower with pimavanserin during the first 6 months follow-up period than with the atypical antipsychotic managing Parkinson's disease psychosis. That means here I am conveying two important points. If you don't treat Parkinson's disease psychosis, the mortality increases significantly. At the same time, if you give pimavanserin for Parkinson's disease psychosis, on comparing with antipsychotics, atypical antipsychotics, the mortality further decreases by 35% when compared to atypical antipsychotics. Further, there are studies, augmentation of antipsychotic medication, like suppose if you want to combine pimavanserin with quetiapine, then they found that negative symptoms improved significantly, but however, the positive symptoms did not improve. That means pimavanserin augmentation with antipsychotic did have a beneficial effect on negative symptoms of psychosis. It may be in schizophrenia or any other psychotic conditions. So, my dear friends, if a patient who has schizophrenia, severe negative symptoms, you can add pimavanserin single dosage, my dear friend, along with an antipsychotic. And it has found to be very effective in negative symptoms. To conclude, pimavanserin is a potent 5-HT2A inverse agonist and antagonist. Pimavanserin is the only FDA-approved drug for treatment of hallucination and delusion in Parkinson's disease psychosis. Pimavanserin is considered to be a valuable option for Parkinson's disease psychosis because it effectively reduces psychotic symptoms without causing any impairment in motor symptoms. And it has a significant advantage over other antipsychotics, especially atypical antipsychotics. That means it decreases the mortality 35%. Pimavanserin when compared to other atypical antipsychotics, my dear friends. So, Pimavanserin is a non-dopaminergic atypical antipsychotics, and it's a very novel agent, my dear friends. Thank you very much for giving your valuable time. Stay safe.